Hi, I'm Dr. Roseann, and what I want you to know about our program, which a lot of times we call it the BBR program, is that it is rooted in neuroscience. I have my 30 years of experience, and we have created this multi-pronged approach that is designed to get to the bottom of what is going on, give you the tools on how to address it as we guide you through calming the brain and resetting the behavior. And I know you're here because you've tried a lot of things that aren't working. And, a little bit about our mental health system, as you're well aware, is that it's a dinosaur. We literally ignore research and we don't ever check under the hood. That is not what I do in my very unique method that you're not going to find anywhere else, which is why people fly in all over the world. You don't have to fly in like you used to do in the old days because we work with people remotely and we send them equipment and we work through, obviously, virtually. And let's talk about what brain behavior reset, what the method is, and why it's so different. And it's going to be an aha common sense thing for you. And you're going to say, why have you not heard of this? Why are not more people using science to inform treatment? There's a lot of reasons why, but we don't have the training. Physicians know very little about mental health, and they are often at the top of that pyramid in mental health when it should be parents and obviously patients or clients, whatever you want to refer to yourself, you should be at the top of that period. And it starts with knowledge. And that's why we do everything with neuroscience. And so what does neuroscience tell us? And why do we call our program Brain Behavior Reset? Well, the first thing we do is we have to calm the brain. It doesn't matter what issue you, your child, or family are dealing with, whether it's OCD, anxiety, learning disabilities, ADHD or executive functioning, PANS, PANDAS, depression, behavior issues. It doesn't matter, right? What matters is that the brain and the body are dysregulated. And you can have understimulation in the nervous system or overstimulation, and they're going to show up in behavior. So you could have sleep problems, right? And that sleep, right? So an understimulated brain is going to oversleep, and an overstimulated brain is going to have trouble sleeping. You can have difficulties with eating, behavioral issues, anxiety, obsessive thoughts. It shows up in a lot of behaviors. And guess what? It doesn't matter what the issues are. You have to calm and regulate the brain. If you don't calm and regulate the brain physiologically is not capable of new learning. It is not capable, and that means taking action. It's not capable of paying attention and thinking. So why are we constantly trying to get people in talk therapy when they're activated? And activation in a nervous system, when you're very activated, which can happen without a clinical issue, it can just happen with compounded stressors, shows up as fight, flight, or freeze, right? So people often use the words like brain on fire, or, my kid is just not listening to me. I call them 7 times. That's a brain that's very understimulated. So we use tools like neurofeedback, PMF, biofeedback, and other tools in our innovative program that regulate the nervous system, calm the brain. And then our behavior reset is we teach people, we guide you in our program to lifestyle changes. Some people do coaching and counseling. Sometimes that's individual, sometimes that's group. You have to learn a new way to respond. Many people with kids, for example, of ADHD or executive functioning will tell me they tried medication unsuccessfully. 100% of the time, you're going to have a side effect with medication, 100% of the time with ADD. And there's always a toxic effect. And they'll say, my kid didn't do anything different. Maybe they paid more attention. Well, you have to teach them something new. So if you've been anxious for 10 years and then all of a sudden your anxiety goes down, what behavior is going to be there? Still often that anxious behavior. So we reset the brain, reset behavior, and that is Brain Behavior Reset. And it's a program. We don't do neurofeedback on its own. We don't do counseling or coaching on its own because we want the best for our clients. And I'm using neuroscience to guide, and obviously 30 years of experience of helping thousands of families. Every family and every person who's struggling has the potential for change. It's, are you willing to make changes? Can you do things that are going to regulate your nervous system, both in clinical, treatments like neurofeedback, right? Which we'll talk about, but also lifestyle changes, right? It's like somebody who lost 30 pounds and then they just decide to eat Cheetos again. That's not really a lifestyle change. It's going to sustain that. So we work with people, we guide you, we give you all the keys to create lasting change, to have that calm brain is a happy family, right? And that's so, so important. And as a special needs mom, I know what it's like to constantly be looking for something that's going to help. And we don't want to be on the worry train. And at times, even I've been driving the worry train, and you need to get off. And the definition of insanity is repeating the same thing over and over. That's Albert Einstein. It's one of my favorite quotes. And yet in mental health, they'll have you do 8, 9, 10 clinical trials of an SSRI when you never responded. So this is different because we are only using science-backed solutions to create change, and we're pairing it with behavioral change. And that's really important. And to learn a little bit more about what neurofeedback is and why it's so pivotal and why it's been a game changer in mental health for so many of my clients, is that dysregulation that we're targeting in our program. Neurofeedback is designed to regulate the brain safely and effectively. It's taking your brain waves that are dysregulated and it's giving it feedback. It's something called operant conditioning through the use of computers. It's measuring and giving reinforcement. Nothing comes through the wires, and the person is able to, within 2 to 3 seconds of the first time you're hooked up, produce the exact healthy combination of brainwaves. It's not a one-time thing. Most people are doing 40 sessions or more. It depends on each person. I decide that, and we make a program and give you, all the information. But most people are doing 2 or 3 sessions a week for about 40 sessions. Our program, typically, most people are completing it within 6 months. So instead of having years of heartache and problems and expense, people are able to, because you have the foundation of a calm brain, learn new behaviors. I hope that's an aha moment for you. That is what is very, very different about what we do. We are really incorporating both. And that's why people have such dramatic change and people come to me. So Brain Behavior Reset is a program. I guide the whole thing. What's amazing is you get a whole team of just hand-selected people supporting you. We have brain reset specialists, we have therapists and coaches, and we work together to create that change in your family with you as our partner. So if you are interested in signing up, getting more information, please get on the call with one of our specialists. And whatever journey you are on, I wish you absolute healing for you and your family, because it's hard when you have a child or you are struggling. But I want you to know there are science-backed solutions that are natural and effective, and that's what we use in our Brain Behavior Reset program.